Thanks for joining us. I'm Judy Simpson. As our population ages, the number of people diagnosed with Alzheimer's disease is at an all-time high and climbing. The effects of Alzheimer's extend beyond the individual patient. It's a disease that impacts family and friends, especially those who serve as caregivers. Today we're going to hear from two Vermonters on the front lines of Alzheimer's disease and learn about a new dementia care coalition that's starting in northwestern Vermont. Amanda Wilson is a medical social worker at the Franklin County Home Health Agency. She is also a professional community educator for the Alzheimer's Association. And Sheila Dooley is caring for her husband who has Alzheimer's disease. Sheila advocates for the Alzheimer's Association Vermont chapter. I want to thank you both for coming in. Now, Amanda, give us a snapshot of Alzheimer's disease, the big picture, and what it means here in Vermont.
Sure. So Alzheimer's disease is a progressive degenerative disorder of the brain. It causes problems with memory, thinking, and behavior, and it's the number 6 leading cause of death in the United States. Over 5 million Americans in the United States have Alzheimer's disease, with over 15 million caregivers providing care for them. It's the only disease within the top 10 of causes of death in the United States that there's no way to prevent it, treat it, or cure it. So it's a significant public health issue, really. You know what that means for us in Vermont? In Vermont, we're an aging state. So there's 12,000 people with Alzheimer's disease, with an estimated over 30,000 unpaid caregivers. So that's friends and families and neighbors providing care.
And Sheila, you are one of those 30,000 unpaid caregivers. Tell us a little bit about what your life is like.
Well, my story starts, my husband and I have been married 9 years. And he was diagnosed in January 2014 after retiring from the VA as a counselor for 22 years. It was at that time that we were given this diagnosis of Alzheimer's, and we decided we didn't have any clue of what to do. So we decided we needed to get help. And I started reaching out to anybody that I could. And I found a group called In Harmony. And they kind of gave us an idea that there is a new normal to living with this disease. And I decided that we needed to get a durable power of attorney. We needed to get our advance directives in place. But as a caregiver, I found that my whole marriage had changed. I wasn't married to the man that I was with 9 years ago. I now needed to cue him to brush his teeth, to take a shower, to put a jacket on because it's cold out. I needed to help him with all of his appointments. He gets anxious. I needed to become the pillar. It was no longer a partnership. It was basically me. And even though when we do anything, I always confer with him and ask him his opinion on something, but in the long run, I make the decisions. I handle all the finances. I handle all the medical appointments. And it's a very difficult situation when you were both doing it together, and then all of a sudden you're doing it by yourself. It's a lot for one person. And in our situation, we just needed to have more help recently, and we found that it's not easy to find.
And so you actually now are an advocate for the Alzheimer's Association, is that correct?
That's correct.
Tell me what you do for that and why you decided to do that.
I decided to become an advocate because I needed to put voice to something that was very hard. And once I put voice to it, it empowered me. And what I do for advocacy is I speak out as many places as I can. I spoke at the Dinner for Hope for Alzheimer's. I was on VPR trying to give an information about what it's like to be a caregiver. I've spoken to the different legislatures, like we've gone to Peter Welch's office and we've gone to Bernie Sanders' office to speak. We are, both of us actually are advocates. And it basically gives us, again, that power to this devastating disease.
Can you give us some insight about accessing supports and services based on your personal experience and what's going well and what's not going so well?
the supports aren't good. There's not a lot of caregivers. We recently had a situation where we needed help. My husband started sliding, and I need help. And because he's a veteran, we get help from the VA. We're very fortunate to be one of those people. But when they tried to contact several companies, they were told there weren't anybody available. So I pushed harder, and I said, I really need help now. So what they did is they allocated more hours for me. And because we live in a different county.
You live in Franklin County.
We live in Franklin County. And they had to pull care from Chittenden County. We had to increase our hours in order to cross the border. And I didn't quite need that hour at the time, but I took it, and it helps. But it just tells me that this is a problem. And if we're getting help from the VA for certain things, what are people who don't have that? How are they managing?
What about support groups?
Support groups, I go to the Alzheimer's support group monthly, and Amanda is starting up a support group in Franklin County, which is going to be great. I also go to a couples support group called In Harmony in Essex. And I find that the couples support group is great because it gives my husband a chance to come and speak and be part of a group. I don't want to leave him behind all the time.
Right.
He needs to be active.
And so, Amanda, you work with the association's professional community educator. Can you tell me a little bit about some of the work the association does to help fill some of these gaps that Sheila has been talking about?
Sure. So the Alzheimer's Association is a national organization. I'm currently working with the Vermont chapter, so we do have chapters at the state level, which is great. The association, with the advocacy, with help from Sheila and so many others, a big part of what they do is that advocacy and reaching out to senators and legislative bodies to talk about the care needs. Recently, the increased funding to NIH was largely due to the advocacy efforts of the association and folks like Sheila that work with them. The association provides educational programs and workshops to community members free of charge, support groups around the state, in person for caregivers, for people with the disease, and telephone support groups. And those are free of charge as well. The association has a great website with all kinds of resources online. And there's a 24-hour helpline that can be accessed 24 hours a day with questions, concerns. They have master's level care consultants that can work with people on their specific issues. I think the chapters really do a lot of really great work.
How about what's going on locally in our communities?
So I think what I've found in my work with the association that's interesting is there's wonderful programs that have been developed, but they've been developed at a national level, and then they're implemented the same across all areas. Vermont is unique. We're different from New Hampshire. We're different from Western states. And then even more so, Franklin County is unique, and that's where I live. Orleans County, all of these areas are so unique. So these programs that are provided don't always quite fit. So it's like trying to fit individualism in a box, and it doesn't always work. In Franklin County, there's probably, last estimates were about 800 people in Franklin County living with Alzheimer's disease. And I want to make a note that all of the statistics that we talk about today are about Alzheimer's disease specifically because it's the most common type of dementia. It's underreported. People are undiagnosed, so numbers are really much higher. And it's not including all these other types of dementia that people are suffering from.
And so there's something very special happening in Franklin County about that.
Yeah, so recently myself, a group of community members, including Sheila, we're really grateful to have her part of the team, are developing a dementia care coalition. So it's a group of people that are coming together to work specifically on improving dementia care in our community.
And what are the goals?
Excuse me.
Sure.
So the goals of the Dementia Care Coalition are really to make our county dementia care friendly, to improve services, to enhance connections with resources and just between individuals. I think one of the strengths of Franklin County is that we're so rural, but people are very close. It's a tight-knit community. While there's a 24-hour helpline with the association, someone from Franklin County might not want to call a national number. So this coalition is working on having our own little hotline so that there's a local number with a local person that they can call and talk to with questions.
How important is that from your standpoint?
I think that's very important because you want to talk to somebody that's in your community.
Right.
And it helps because they understand where you live, how you live.
Mm-hmm. And so what are some of the issues, do you think, that are going to come up with this coalition?
So we're working on, what we need to do is invite more people. So this is a small group of people that's kind of handpicked that have come together, but Franklin County is so broad. There may be so many other people that want to get involved, that want to add their voice to the conversation. What we need to do is assess, what are the needs? What does our community need? In social work practice, we use vision mapping. So our vision is a friendlier community, a place where it's healthy and secure to grow old and be a caregiver. So what we need to do is figure out what are our strengths and what are our challenges. And a group of 10 people doesn't know that. We need to ask everybody. Once we can figure out what the strengths and the challenges are, we can figure out what our next steps are to reach our vision. Mm-hmm. I think it's important to identify the gaps, but equally important to identify the strengths so that we can build upon the things that we can do really well.
How important do you think it'll be to get some medical professionals on board with this as well, to be able to say, look, you know, this is your diagnosis, and here's a great place to start?
I think it's imperative. Physician outreach is something that the Alzheimer's Association does, but I think we need to be doing it at a local level. Alzheimer's disease is becoming so prevalent, but I don't believe that medical professionals are adequately trained with the information and then therefore are not passing along to their patients the right information. So I think that that's really important, and there's strength in healthcare professionals and what they say, though I believe there's equal or more strength in what people like Sheila say.
I know, Sheila, you're a tremendous resource, not only for the community, but also for even the medical professionals. What do you want people to know? What do you think is the most important thing as an Alzheimer's caregiver that you want people to know?
I want people to know that there are resources out there. You just have to kind of beat the bushes a little bit to find them. And one of the things that I was talking about before, maybe someplace else, was that I think that when a person is diagnosed with dementia or Alzheimer's, it is a devastating, it's a life-altering diagnosis. It would be wonderful if, say, the primary care people had a care team where they had a social worker, a counselor, dietitian, speech pathologist on board, so that when the person was diagnosed, they could send the family to them and say, okay, here you go, and they can help the person navigate through all of this stuff instead of having to beat the bushes.
And so for our viewers who want to learn more about the Franklin County Coalition, who should they contact?
So if someone wants to learn more, they can contact me directly by phone. They can come to the community forum. So we've scheduled a community forum. It's free. It's open to the public of Franklin County, January 23rd from 2 to 4 at Northwestern Medical Center. Snacks and drinks will be provided. So we're really excited about that because we want to hear from everyone. They can also email us at franklincountydementia@gmail.com. And I think coming to the coalition is really, to the coalition forum, is the most important thing that I get asked for. We want to, I think just getting people there is going to do the first step. It's going to connect people. People are the best resource for one another.
Can I just add one other?
Absolutely.
One thing that you asked me what I wanted to end with is one of the statements my husband has always made. He was a soldier. And as a soldier, he always said, you never left anybody behind. And what I'm saying to everybody, as Alzheimer's families, please don't leave us behind. Don't forget us.
Thank you so much for joining us today.
Thanks for having us.
That's our program for today. I'm Judy Simpson. I'll see you again next time on Across the Fence.